I've been doing interventional cardiology for 25 years almost now, and I think it's very rewarding. It deals mainly with patients with coronary disease. So there's basically two subsets of patients that we see. One are the patients with chronic chest pain that has been going on for some time, that they have symptoms, that we can bring them in, and we do a heart catheterization where we look at the arteries and see if there's blockages, and then fix those blockages with a stent, usually do some balloon work and a stent. The second subset is very rewarding, as we treat heart attacks. So if patients are coming in having a heart attack, we time ourselves to make sure we get that artery open within 90 minutes, because the sooner we get the artery open, the better the patient's chance of survival is. So when someone has a heart attack, we know they're at risk of having another heart attack because the illness, the pathology is already there. So we want to make sure they don't have another one as best we can. So we do follow these patients long term to make sure that we're doing everything we can to prevent that second heart attack from occurring. We try to encourage everybody to be active and exercise, because exercise is this great pill that does help control the cholesterol and the diabetes and the high blood pressure without actually taking a pill. So it's kind of a natural way of preventing another heart attack. We've just started a program for chronic total occlusions. Dr. David Wones and myself are the ones that are doing these. So we've already taken arteries that have been closed for 8 to 10 years, the patients that have chest pain that are on 3 and 4 different medications and can't be active because they have chest pain. There are new technologies out there now that we can go and open this artery up, and the patients just feel great. We have some fantastic testimonials from patients. One gentleman told me he left here, he went down to Florida. He couldn't walk, before we did the procedure, he couldn't walk a block without getting chest pain. He went for a walk on the beach with his wife, walked 2 miles, came back, felt so well, he walked another 2 miles by himself just because he could do it. And so patients who have lived with chest pain for years and years suddenly can be relieved. And when you do take someone that's so sick and you help them, they're so appreciative. That's what gets you out of bed in the morning, and that makes you want to keep coming back for things like that.